Hello everyone, my name is Dr. Annie Snyder. I'm a pelvic health physical therapist here at Fit PT in Hudson, Wisconsin, and today we are talking about vagus nerve regulation techniques. The vagus nerve is part of the autonomic nervous system, specifically within the parasympathetic component. So the parasympathetic nervous system is more known as the rest digest versus the sympathetic nervous system is the fight or flight. These two systems help with involuntary bodily functions, thinking, breathing, heart rate, blood pressure, digestion, even things like coughing, vomiting, sneezing. But we also have a sense of feeling in the body when we are dysregulated within these two nervous systems. If we are stuck in more of that fight or flight or sympathetic nervous system, we can feel that in our bodies where we hold more tension. We have a hard time monitoring or tracking our heart rate variability. So there are techniques that we can use to help bring us back into more of a parasympathetic nervous system. It's not an all or nothing, meaning like it's not a switch of we are in sympathetic versus parasympathetic, but we need a balance of the two. So here's some easy ways that you can tap into that vagus nerve if you're feeling a little bit unbalanced within the body. The vagus nerve travels outside of the spinal column and it exits the skull right behind the ear on either side. It courses down along the side of the neck, goes underneath the collarbone, and then on the left side goes to the heart, comes back into the center, continues traveling down, pierces through our respiratory diaphragm, and then it innervates a lot of our organs within our thorax. The communication between the brain and the organs is ongoing throughout the day, but we want to help regulate more of that rest digest component with these techniques. So starting off with how we are using our breath. So our respiratory diaphragm is kind of like a bowl inside of our rib cage, and that can help actually like massage or trigger that nerve as we are taking nice, big, expansive breaths. So thinking about breathing all the way around the rib cage like an umbrella is opening. We can also layer in techniques with our nose. So alternating nostril breathing has been shown to help regulate the nervous system. What you would do is plug one side of the nostril as you inhale, nice and slow, and then you switch nostrils, closing the opposite side as you exhale. You can continue going back and forth for about a minute with that, and you might just feel a nice kind of hum in the body as you're doing that. We can also think about how we use our vocal sounds to help regulate that nervous system. So using nice soft humming sounds can help move us into more of that rest digest, along with singing. So we want to think nice calming sounds for that. And then more massage techniques or physical hands-on options. We can do a little bit of traction behind the ear where that nerve is coming out of the skull. So looping a finger right behind the earlobe and then just inside of the ear and pulling kind of down and out. That's going to give a little bit of traction on that nerve. We don't want to yank too hard, but just a gentle pull. Holding for about 30 seconds, and then you can layer on the breathing techniques with that of having that nice umbrella expansive breath along the rib cage. And then after 30 seconds, you can switch to the other side. This is really easily done throughout the day, whether you're sitting at your desk, kind of holding your ear, driving, getting ready for bed, whatever it is, you can just gently work on that traction. You can also do some soft tissue work along the side of the neck. So if you feel like a lot of tight gripping muscles along the neck, just doing gentle circular movements, or even having your hands kind of placing right along the collarbone and sternum, giving a little bit of a downwards traction, and then moving the neck side to side, and you'll feel just a little gentle stretch in the front and side of the neck. Rotating the head side to side, and doing that for about a minute can help just, again, regulate that nervous system. You can also use some cold therapy, meaning like a cold washcloth or even an ice cube, placing it along the side of the neck. If you're using an ice cube, you want to make sure that you're moving it constantly versus holding it against the skin directly. But a nice cold washcloth along there works as well. And that's kind of thinking like a hard reset or a hard shock to that nervous system to move you in the direction that we want. Another option is using kinesio tape. So I pre-cut a strip here Typically the kinesio tape is a little bit thicker, so you can just cut it in half about an inch long, and then rounding the corners so that it's able to not get yanked down by hair, clothing, and just stays on there a little bit longer. So you would rip off one end of the tape, and then finding the groove just behind your ear, you place the tape right along that groove and rub it down a little bit to have the adhesive activate. And then you would tip your head to the opposite side just gently, and then peeling the backing off the other side of the tape, you gently place it along the side of the neck, kind of straight down from where you attached it behind the ear. And then rubbing that as well. You don't need to put any stretch on the tape because we're bending the head away. And then coming back up, so the tape will just be right along the side of the neck there. You can leave that on for a day, even a couple days, and you can also do the other side of the neck as well. This is a pretty easy way to get a little passive stretch on that nerve so that you're not having to actively think about it, but it just nudges you a little bit further in the direction of some nervous system regulation. There are a lot of other ways to tap into that nerve, whether it is movement, dietary things, or even some hands-on techniques that we use in the clinic. So if you are curious about other ways to help with nervous system regulation, whether it's to help with overall anxiety, tension in the neck, the jaw, the abdomen, the hips, the pelvic floor, or feeling like you have tried so many other things, but maybe this nervous system regulation is new to you, feel free to reach out to us. We're happy to chat about other options, or scheduling with us, we can go through more techniques together on what might be right for you.